When Scotty was younger, he'd sometimes lose control. Screaming and crying, he'd tear his room apart, but it didn't feel like a choice.
If they say that, oh, you're just acting naughty and it just kind of makes me feel sad. Because I can't help it, because my mum drank while I was in her tummy.
Scotty has fetal alcohol spectrum disorder, or FASD, after his biological mother drank alcohol while pregnant. He now has support, but the Alice Springs teen worries many people, including teachers and police, don't really understand kids with FASD.
That's why they're breaking in and stuff, because they need someone to talk to, because they don't have anyone to talk to about their feelings.
FASD is a group of conditions resulting from alcohol exposure during pregnancy. Symptoms can include learning and behavioural difficulties and delayed physical development. Research shows people with FASD are hugely overrepresented in the justice system.
They've got pages and pages of criminal history, and it's one of the reasons is that they just can't learn from those consequences, and so dealing with them in the normal way that we think of in locking them up isn't actually going to help the situation. We need to get them the support to learn different ways.
There are fears many of Australia's most vulnerable children aren't receiving a diagnosis or support until they're behind bars.
We're seeing more and more people with unmet disability, mental health and trauma needs ending up into youth prisons and adult prisons.
Meg Baker has been a foster mum for more than a decade. She's cared for many children with FASD and says in remote Australia, services can be almost non-existent.
What is really heartbreaking is the inequity in the bush. Many regional and remote areas don't have access to the early intervention that should be accessible to every single child with FASD.
Researchers estimate up to 5% of Aussie kids live with the condition, but rates are believed to be much higher in Western Australia and the Northern Territory, where historic trauma and disadvantage can lead to alcohol abuse. The Commonwealth has funded public FASD clinics in New South Wales, Victoria and Queensland, but there are no similar clinics in the rest of Australia. In a statement, the federal government said it's currently considering opportunities to spend money on more FASD services in WA, South Australia and the NT, and said it's already made substantial investments in tackling FASD, but acknowledged there's still much more work to do.
What we want to see is a fair distribution of fundings to all states and territories so that no child misses out.
In the meantime, Scotty knows he's lucky to have received support for FASD and hopes he can inspire others living with the condition.
What I love about myself that I just care about everyone, look after my family, look after my friends, and be like a role model for everyone.